Hi, my name's Tim Brown and I'm the Global Brand Manager at Vaxaid. So Vaxaid pumps are unique in that they're designed to be used in both air and in water. And the differences between air and water are quite dramatic. When you put your penis inside a vessel that's filled with air, the compression sometimes is a little bit inconsistent, and that's because air doesn't compress in an even and uniform manner. The inconsistent pressure can give some inconsistent results. However, once you fill the vessel with water, you change the compression from a pneumatic compression to a hydraulic compression. Hydraulics are entirely predictable. That now means the pressure is consistent and even all the way through the pump, and it's the consistent, even pressure that gives the best results. Today we're lucky enough to be joined by two esteemed doctors. The first doctor we're going to talk to is Dr. Elliot Justin, who's going to talk to us about all things penis-based, including nocturnal erections. The second doctor we're going to talk to is Dr. Lance Franks, who is a pelvic expert and is going to talk to us about all things penis pump based. Dr. Justin, thanks for chatting to us today. I wonder if we could start with what causes erectile dysfunction.
Well, the causes of erectile dysfunction are manifold. Let's first talk about how prevalent it is. 50% of men by age 50 have erectile dysfunction, and it goes up 10% per decade thereafter. At age 30, it's about 25% of men. In younger men, it's dominated by performance anxiety. In older men, it gets more complicated. This could be diabetes, hypertension, atherosclerosis. Unfortunately, it's often caused by medications that are prescribed to men, with the antidepressants and the antihypertensives having significant side effects that impact a man's sexual function. And then there's alcohol, recreational drugs, other problems that enter it. So it's complicated to sort it out. I like to break ED down to two groups. There are men who can't attain erection and men who can't sustain erection. A man who can't attain erection, he needs to see a specialist, a urologist. But a man who can't sustain an erection is already getting blood into their penis. So it could be anything from a psychological problem to a medication-related side effect or a medical problem. For a man to function well, he has to have good nerves, with diabetes being one of the things that can lead to ED. It's a neurological damaging disease. Vascular diseases like hypertension, atherosclerosis can decrease the blood flow into the penis and interfere with a man's ability to get erections. Man also has to have good muscle function. Now, the penis is controlled by smooth muscle, not skeletal muscle. You can't work it out in the gym. You actually have to work it out at home. And it's important for a man to have erections at night when they're sleeping. And it's important for a man to have erections and have sex in order to exercise that critical smooth muscle. But the most common problem is performance anxiety.
Okay, that's really interesting. So why do men have nocturnal erections?
Nocturnal erections are a really interesting phenomena. We all know about morning wood and we laugh about it, but a healthy man should have 3 to 5 nocturnal erections per night. And we don't have any good data until now about what that number should be for different age groups, 25 to 35, 35 to 45. And my company, FirmTech, now has the largest database of erections. We documented 50,000 erections, and we'll soon be publishing data that will allow men to say, hey, I'm 55 years old, what's normal for my age? But on average, it's 3 to 5 nocturnal erections per night. And this is the way of the body getting blood into an organ that needs blood in order to be healthy. A man who's not having nocturnal erections, aside from signaling that they have a disease, is also not getting enough blood into their penis in order for their penis to be healthy. As to what causes them, we actually don't know.
Obviously, there are lots of different solutions for treating erectile dysfunction. What are the real differences between using a penis pump and perhaps taking the blue pill?
There are many differences. Let's start with the advantage of a penis pump is its results are sustained, whereas the pill is just a temporary solution. Pills put more blood into the penis, but they don't keep it there. And men need, in order to have a satisfying, long-lasting erection, is to keep the blood in the penis. And when a pump is used over time, it can achieve those results, often in combination with God, they call it penile constriction ring. That's like, to my mind, some like Nazi term. I mean, what man wants to have a constriction ring put on their penis? No, it should be called an erection ring because it's helping to sustain an erection, helping to give a man more pleasure and to last longer.
If you use a penis pump over a period of time, do you think that might help create better and longer lasting erections?
Yes, I do. I've had many men report to me that their erections over time are firmer and last longer. And utilizing a product that we've developed, the Tech Ring, we've actually seen that demonstrated to us by our patients that if men pump for several weeks, maybe we're seeing it around 4 to 6 weeks, we're seeing that their erections are harder and last longer, and the benefits are sustained as opposed to just taking a pill.
That's really interesting. And you briefly touched on this already. You know, when you've spoke about diabetes and high blood pressure, why does that have such a negative effect on erections?
Because, well, I'll focus on high blood pressure first. Uh, in order to have an effective erection, you have to get blood into the penis. And high blood pressure
Sure.
produces a narrowing of the blood vessels that go into the penis, so there's less blood flow. In addition to which, we doctors often don't serve people well because we prescribe medications, certain of the antihypertensive medications, the beta blockers, the ARBs, they decrease the blood flow into the penis. I'll just talk about myself. I started taking lisinopril last fall for high blood pressure, and my erections were 15% less hard than they were because the medication was actually interfering with the blood flow into the penis. I stopped taking it.
Wow.
So diabetes not only affects the blood vessels, narrows them and interferes with blood flow, but diabetes also damages the nerves. So the penis obviously needs intact nervous system in order to give just to sustain an erection.
Erection problems are sometimes physical, sometimes psychological. Do you believe using a penis pump actually deal with both physical and psychological problems?
I do. On the physical side, as we discussed before, I think that the use of a penis pump can lead to sustained increased blood flow into the penis. On the psychological side, I think by increasing a man's size and girth, it can make men feel more confident about their performance, uh, and that's valuable as well too. Look, the PD. I have patients to whom I prescribe the PD-5 medications. They tell me it works if it's in their wallet. So the placebo effect is really powerful, and
Yeah.
we need to recognize that its impact is significant.
Okay. Are there any downsides to using a PDE5?
Not many. There are side effects. Most of the downside actually occurs because of the male mentality. The male mentality is, hey, if the doctor says take 10, I'll take 20. If the doctor says take 20, I'll take 40 or 60. And then men, on occasion pass out because they're not getting blood going. They might be getting more blood
Wow.
going down to the little head, but they're not getting enough blood going into the big head.
Right.
There can be certain visual disturbances as well, but they're really uncommon. I mean, overall, it's a safe class of medicines. On the other hand, it does interact with certain other medications that men take.
Okay.
And so men really, if they're taking many prescriptions, it's kind of dangerous when they go online and get pills because they really discuss with their doctor or the pharmacist, is the pill that I'm taking going to interact with some other medication for heart disease or blood pressure? And that's really the major risk with danger with the pills is when men are taking unaware of potential dangerous interactions of the medications.
Okay. And are there any downsides to actually using a Vaxaid penis pump?
I can't think of any downsides to using Vaxaid penis pump. I mean, I personally have tried it. It's really comfortable. I'm obviously because I'm in this field, I've tried a variety of your pumps,
Of
competitors'
course.
pumps,
Sure.
and I think that your the Vaxaid pumps because they're water based are uniquely comfortable. So I think you significantly decrease the risk of bruising, um, or frankly, people not complying with proper use. Well, they can't be overpumped, and they're easy to use. So no, I don't really think they're any risks. I mean, in my background, I'm an emergency medicine physician, and I think I probably treated about 180,000 people. I probably removed 10 to 12 cock rings in the emergency department that people couldn't get off. I saw a couple of men who had taken too much Viagra. I never saw an injury from a penis pump in the emergency department. No fractured penises or other things that people might worry about. I think penis pumps are really safe, and the Vaxaid is a uniquely well constructed penis pump.
That's great. That's great. Would you suggest to a patient, obviously I appreciate you don't know the medical history, but just as a generalization, that there might be a benefit in using both the Vaxaid pump and the blue pill at the same time?
Yes, I think that they both are working by different mechanisms. I mean, the pill is working acutely, if you will. It's working in that immediate situation. It doesn't lead to any long-term benefits. Whereas pumping over time will lead to sustained benefits. But now that we have a device, the tech ring that we manufacture, a man can actually test that. A man can actually say, well, now that I've been pumped, do I still need the pill?
That's really interesting. I found everything that you've said today, Elliot, actually fascinating. It's a real eye-opener for me. So I appreciate all your time, all your medical know-how, and the explanation. Thanks ever so much for your time today.
Thanks so much, and I appreciate your products.
So today I'd like to introduce you to a good friend of mine, which is Dr. Lance Franks, who's a pelvic expert. So thanks for joining us today, Lance. First question I've got for you is, how does a hydro pump work?
So a hydro pump uses water as the suction medium to assist with men getting an erection. And so the water vacuum creates that suction rather than using air like other traditional pumps. It uses water to assist with getting an erection.
Okay, right, that's interesting. And do you have to be sexually aroused to actually use the products, or does that not matter?
It doesn't matter, actually. You can be flaccid or, semi-erect. It's a way to help get an erection, and so you don't have to be aroused in order for it to be effective.
Okay. And is using the pump a sexual experience, or is it non-sexual?
It doesn't have to be a sexual experience. It can be a good way to regain effective use of the penis for erections. And so you can use it before sex, but it doesn't always have to be used before sex. It's just a good way to maintain penile health.
So would you recommend using the pump on a regular basis? Would that give the best results?
In the long term, yeah, it would. Using a pump regularly is going to help improve blood flow into the penis. And in the long term, it's going to help with better erections and more firmer erections.
So how many times a week would you suggest using it? Would you suggest perhaps using it as part of your daily wash routine?
Yeah, with the good thing about using a hydro pump is because it uses water, it's easy to use in the shower, and you only need to use it 5-10 minutes a day. So using it every day can be a good part of your kind of bathing or hygiene routine, just kind of like using a toothbrush.
Right, okay. And of course, we all want to use a toothbrush every day, so that kind of makes
Right.
sense. What would you say are the definitions of good penile health?
Good penile health, having the ability to use your penis when and where you want, effective erections that people are happy with, and quality and the firmness are there. Just overall, when we think of health and what it means to be healthy, is if our tissues are working the way that we want them to, that would imply good penile health.
Okay, and as you age, is it typical that penile health actually starts to become not necessarily a problem, but isn't quite as good as it was when you were younger?
It is, the muscles of the pelvic floor and the penis, are just like as we age, it's common for our muscles to start to atrophy and for our muscles to get a little weaker. And so it is a normal process of kind of declining penile health as we age. But with using devices like a hydropump, it can help maintain the use of our erections and the use of our penile health for longer.
Okay. And I know you've touched on this briefly already, but would you suggest that a water pump is better for the penis than an air pump?
Yes, hydropumps are more stable. Well, we know water is more stable under pressure than air is. Air particles aren't as compact as water is under pressure, and so whenever you're using a water pump or a hydro pump, the suction that's created within the vacuum within the cylinder is more stable, and so blood is drawn more effectively consistently throughout the shaft of the penis versus with an air pump. Sometimes the suction isn't as uniform and it doesn't create as good of a seal, and with air pumps you're more likely to blister or more prone to sores because of that instability within the vacuum. And so water pumps are more superior.
Okay, that's also really interesting. So when it comes to recommendations to your customers that have erection problems, do you actually talk to them about using a water pump rather than an air pump?
I do. Yeah, the hydro pump is the pump that I always recommend because of what we just talked about. It's safer and it's more stable, and so it creates a better erection in the long run. And so whenever I'm talking to my patients about vacuum pumps or hydro pumps, the hydro pump is usually my go-to recommendation.
That's great. Okay. And if you're a healthy guy, so you've got no erection problems at all, are there any benefits to using a hydro pump as part of your daily wash routine as a healthy guy, as opposed to somebody with erectile dysfunction?
Yeah, I mean anybody can benefit from using a hydro pump, especially for the premise of better penile health over time. It's it's kind of a concept of if you don't use it, you lose it. And so maintaining the health that you do have only sets you up for better success as we get older.
So if someone's had ED for a long period of time and perhaps the blue pill hasn't been as effective as it first was, would you suggest that using a hydro pump will give them the ability to gain and maintain an erection? And will that improvement be immediate or will it be a gradual process?
So if somebody's struggling with ED and the little blue pill isn't quite getting them to the results that they want, the whole purpose of a hydro pump is to inflate the penis and draw blood flow into the penis to help get a full erection. And so if usually, patients will use the pill in tandem with the hydro pump to get that full erection. And there are other devices like a penis ring that you can use with the hydro pump to help keep the blood inflated once it's in there. And so the combination of the vacuum pump, the pill, and a penis ring can help get blood flow into the penis and maintain that blood for, if somebody's trying to engage in sexual activity, it can help maintain that during the duration of that experience.
And do you think that improvement will start almost immediately or will that gradually get better as time passes?
So the improvement, that's kind of a two-faceted question. The first part, you're going to get immediate improvement because the the device, the hydro pump, is mechanically drawing blood into the penis. So you're going to automatically get an erection in real time when you're using it. Over time, continuously getting blood flow into the penis, continuing releasing those hormones is going to help. It should help in the long run promote better erections as well.
That's great, Dr. Lance. Thanks ever so much for your time today. I found it really interesting talking to you. It's been really good advice. Thank you ever so much.
Yeah, no problem. Thanks for having me.
So this is the Vaxaid V7 and I'd like to show you quickly what's in the box. So the easiest way to actually open the box is to take a small knife and actually just cut straight across the top, straight through the security seal. Makes it easy to open the box. You actually get a premium quality carry case, a zipper on top with all the contents inside, and also a side pocket as well for secure storage of anything else that you want to put inside the carry case. In either the main pocket or the front side pocket, you'll also find the instruction manual. This explains everything you need to know about the Vaxaid pump and how to use it. So we also have a Vaxaid padlock, which is used to secure the bag so that everything inside is kept nice and private. When going into the main pocket, everything is securely protected during transport by some air bubble bags. You get a cleaning sponge. The cleaning sponge is put together like so. The pump itself is also inside the bag. The pump has got the extension hose inside, and it's also got the removable comfort pad as well. The Vaxaid cleaning brush has been designed in such a way that the convolutes actually fit perfectly into the convolutes onto the pump, and obviously the cleaning brush is also long enough so you can clean right to the top of the pump. It also comes with the erection rings inside. The erection rings are varying sizes, from something quite large to something relatively modest, and the erection rings are unique. They're designed to be used while you're using the pump. They're placed against the groin. They have two nodules. One at the top is for the dorsal vein to feed blood into the penis, and one at the bottom is there for the urethra so normal ejaculation can take place. We have an additional set of instructions on a Vaxaid USB. We have a shower strap, and that is to support the weight of the pump when you're actually in the shower using the pump. We also have the handball, attaches to the hose and then to the pump to make the pump easier to use. We also have some pump cleaner as well, and we have some Vaxaid lubricant, so when you use the pump in air it provides lubrication for the penis. And finally we have a Vaxaid towel, so once you've cleaned it you can actually dry the pump. So that's everything that's contained in the Vaxaid V7 kit. So there are a couple of ways in which you can use the pump. The first way is you can place the pump against your groin, put your penis inside the vessel and then compress the gaiter. Okay, but the easiest way to use the pump is to actually attach the handball pump and hose, and then all the work is being done by the handball part and you're actually being drawn up the vessel. So what I'd like to do next is show you how to use the pump in water. First of all, you simply fill the pump with water. If you're using the product in the shower, you need to keep your finger over the black pip on the end. The reason for that is if you remove it, water will come straight through. In the bath, that's not too much of an issue. All you do then is insert it over a flaccid penis, attach the handball pump and hose, gently squeeze the pump against your groin until it seals. And once it seals, all the work is being done by the handball pump and you're gradually being drawn up the vessel. Once you've created the erection, you maintain the erection for 3 minutes before releasing the pressure. To do that, simply press the clear part on top, or twist, press the clear part on top and remove the pump. And the second way you can use the pump is without actually using it, without the handball pump and hose. Again, exactly the same. In either the bath or the shower, fill the pump with water. You then insert it over a flaccid penis and you pump. The exact amount of water removed from the vessel has to be replaced by something. Because the penis is inside the vessel, it's replaced by the expansion of the penis. And you simply pump till you can't pump anymore. At that point you've created an erection, but it's an erection under pressure. Maintain that pressure for 3 minutes and then simply twist and press the clear part on top of the pump to remove the pump from the body. I'm going to talk to you about the erection rings. They are a unique erection ring. So they have a nodule at both 6 o'clock and at 12 o'clock. And the reason why they are there is The 12 o'clock nodule is for the dorsal vein to feed blood to the penis, and the 6 o'clock nodule is there for the urethra so normal ejaculation can take place. How you actually fit the rings is you place them on the penis before you start to use the pump. So simply, it's placed over the penis, ensuring that the nodules are at 12 o'clock and at 6 o'clock. You then put the penis pump over and you pump the penis as you would normally with either the handball pump or without, whichever is your personal preference. As the erection is created, the erection ring tightens around the penis, therefore closing the valves so that the blood flow cannot return back to the body. So once you've created the erection, you can remove the pump straight away pretty much, because the erection ring is actually holding the erection in place, stopping the blood flow back to the body. So I'm sure, like me, you'd like to thank Dr. Elliot Justin for joining us and Dr. Lance Franks. I found what they had to say really interesting. If you have any questions, please feel free to drop them in and we'll see if we can get them into our next webinar.